Compassion and Choices works across the country to advance and protect fully informed, patient-directed end-of-life care, and that includes a robust, bipartisan federal policy agenda. Today, we're going to walk you through our current federal work, including our federal policy vision, the regulatory landscape we're navigating, and updates on legislative activity happening right now on Capitol Hill. Let's start with the vision. What does a truly patient-centered end-of-life care system look like at the federal level? First, we believe that your zip code should never determine your access to care. Federal programs need to support access to the full spectrum of end-of-life care options, regardless of geography. That starts with changing the culture of medicine. Every provider should be fully aware of or trained in palliative care, which is medical care and support for people with serious or advanced illnesses focused on providing relief from pain and other symptoms, and genuinely responsive to what each patient wants. That means bringing the full care team to the patient, not just physicians and nurses, but chaplains, social workers, and end-of-life doulas. We also believe palliative care should be more integrated into emergency services so that people aren't forced to get unwanted treatment simply because they arrived in an ER without their wishes on record. Medical aid in dying should be part of this continuum too. This care option should be available to all eligible patients, regardless of where they live, and integrated as one part of the gold standard of end-of-life care, rather than treated as a last resort or an outlier. Care also needs to meet people where they are, literally. Many people at the end of life can't leave wherever they call home. In-home care and telehealth access aren't optional, they are essential. And all of us, regardless of age or health status, should be planning what we want for our end-of-life care, or advanced care planning. Completing an advance directive, asking for a medical or provider order of life-sustaining treatment document, often shortened to POST or MOST, are two of the most important steps you can take to ensure your wishes are honored in case of a medical emergency. Your advanced care planning documents need to be revisited over time as circumstances and wishes evolve. Our federal policy priorities also include innovative models to ensure that terminally ill patients have access to concurrent care, meaning that they can receive limited curative treatment and hospice care at the same time. Support for emerging therapies like psychedelic-assisted therapy with rigorous data collection, and increasing access to integrative care models and highlighting advanced directive documents for dementia diagnoses that specifically address stopping aggressive interventions that are too common and too often unwanted, including patient-driven decisions about eating and drinking. People with dementia deserve to have their wishes heard. Advanced directives are an important component of how we make that happen. One area where our advocacy has already made a real difference is telehealth. In 2020, at the height of the pandemic, Compassion and Choices successfully pushed for regulatory changes that allowed telehealth to be used for common end-of-life care services. That was a hard-won change, and it has since benefited countless patients who can now receive essential care at home. We're working on several fronts to make those rules permanent, including submitting formal comments in response to proposed telehealth rules in coalition with the Alliance for Connected Care. We're making the case that telehealth is not a pandemic-era workaround. It is the future of equitable end-of-life care. We're also on guard as the current federal environment presents real concerns. The ongoing restructuring of federal health agencies has already created disruptions for patients, providers, and the programs that support end-of-life care. We're monitoring those changes closely. We're also watching proposed changes to teleprescribing oversight. Stricter regulations could affect the ability of hospice providers to remotely prescribe medications critical to symptom management, including pain relief. For patients in their final days, telemedicine access is essential to receiving care that aligns with their values and priorities. On a more encouraging note, proposed changes to regulations on treatment options like psychedelics may open doors for new research into therapies that may meaningfully benefit those with a terminal prognosis. Regulations are not just bureaucratic fine print. They shape what care looks like in practice at bedsides. Our legislative advocacy and policy teams continue to lead the way in advocating for innovative solutions. They monitor current proposals, submit comments, and advocate directly to ensure that federal regulations reflect our vision of fully informed, patient-directed end-of-life care for all.
Let's look at what's happening in Congress right now. The appropriations process for fiscal year 2027 is underway. The House is expected to act as early as May, with the Senate following no sooner than July. The current fiscal year ends September 30th. One item we're watching closely is the House Financial Services and General Government Appropriations Bill, which includes a provision that would attempt, once again, to repeal Washington, D.C.'s Death with Dignity Act. We're opposing that effort as we also continue to explore and advocate for reforms to or repeal of the Federal Assisted Suicide Funding Restrictions Act, known as ASFRA. We're closely monitoring the political landscape as we get closer to November's midterm elections. In the meantime, our federal team has been busy since the start of the 119th Congress. We've met with staff from more than 100 congressional offices and met directly with more than 31 representatives and senators to build support for our portfolio of high-priority bipartisan bills. Some highlights of our congressional agenda include the Connect for Health Act, which permanently expands Medicare telehealth coverage, removes the geographic restrictions, includes the home as an eligible care site, and eliminates unnecessary in-person requirements for telemental health services. The Credit for Caring Act, which would create a tax credit for working family caregivers. The Alzheimer's Screening and Prevention Act, which would cover blood-based dementia screening tests under Medicare. And the Lowering Costs for Caregivers Act, which would let people use HSA and FSA funds to cover care for parents or loved ones who aren't their dependents. We're also advocating for several bills to expand provider education on palliative and end-of-life care and awareness and completion of advanced directives, which you can see descriptions of here. On the opposition side, we're actively fighting two bills that would directly harm D.C. residents. The Bowser Act and H.R. 7196 would repeal or amend D.C.'s Home Rule Act, creating an opening for Congress to invalidate D.C.'s Death with Dignity Act, eliminating access to medical aid in dying for district residents. Protecting existing access to medical aid in dying remains among our top priorities at both the federal and state levels. We're not doing this work alone. We partner with organizations like the Coalition to Transform Advanced Care, the National Partnership for Healthcare and Hospice Innovation, Liberty Forum, and the Alliance for Connected Health to advance our shared priorities. We remain intentional about meeting our organizational commitment to diversity, equity, and inclusion, engaging in partnerships with the League of Minority Voters, Congressional Black Caucus, Congressional Hispanic Caucus, and the Asian Pacific American Institute for Congressional Studies, among others, to ensure that our advocacy reaches every community. Finally, we are in contact with the congressional delegations of Illinois and New York to ensure they are aware of the medical aid in dying bills recently passed in their respective states, and to offer to serve as a resource should there be any questions.
Our goal is a system where the care you receive at the end of your life reflects your values and your wishes, not where you happen to live.
And that work is happening right now, in congressional offices, over lunch with coalition partners, and in every conversation we have on the Hill.
Thanks for watching, and thanks for being part of this work.